central line.
So I'm gonna
Inspect for any complications.
And I would ask the patient to turn the head to the opposite side.
awesome.
Okay. At what time does she have to put on the mask?
And then
So you could put on the mask now as well too if they're like confused and not cooperative. For the most part, if he is, we'll say that he is. You would have him turn and you would don the mask if he was not cooperative.
Right, so he has the mask on?
Yeah.
Okay, so I'm going to start by removing the, how you call it?
The dressing? Yeah.
Whatever, okay. So, is there any specific way to do it, or like just like?
Very good question. So what I usually like to do is the bio patches right here. I like to start around and then just start working my way up because then I can remove it usually with the bio patch at the same time. So kind of here and just go this way.
Okay, so first you're gonna take off the edge,
Right.
and then you're just gonna go to the center.
Right.
Okay.
Exactly.
Okay, so I would do like this, and then take it off. Okay.
It's going to be harder on the mannequins just because it's plastic. So human, it's going to be a lot easier to do. So that one's trash. Good.
And then before I do my inspection, I think I have to take off the bio.
Yes, you're correct. Let me get this off.
Okay. So then,
And remember, every time that you're anything, the whole point of this is to make sure that we don't get infected, right? So when you're taking out the bio patch, you want to make sure that you do everything you can to try not to touch the site.
oh,
There
okay.
you go, right?
So, okay, so it was like this.
Yeah, so you want to, there you go. Be very careful with all of those as well, too. Now this should be gone, so that's good.
Okay.
Okay, so then I'm gonna do my inspection. So I'm looking for redness, any kind of fluid coming out, any sweating. So I'm just gonna see that everything looks good.
Okay.
Okay, so then since everything looks good, I'm gonna take off my gloves, do hand hygiene, and I'm gonna start working on my kid.
Wait, do I ask the patient to turn his head? Should I have already done
Yeah, in the mask. No, I think yes, turn his head. And then when you open that, you like push up.
Oh, okay.
And so it should be, yeah, so it looks good.
That's right. Okay.
Let me make sure that we're gonna put the mask.
Where is that?
That's the order that it should be. And that's how it'll be packaged.
Okay.
Oh,
So
wow.
before I
At the
do
very
anything,
Before you take
I'm
the
gonna
mask
put on the drape on the
so
patient,
that it's like
and I'm gonna grab it from the outer 1 inch part.
okay, great. Sterile gloves.
Okay.
Okay, shiny part. Where's the shiny part? Oh, right here. So shiny part down. And I'm gonna fix it in a little bit. Okay, so I'm gonna get my gloves.
So you would do the mask if you didn't have a mask on already.
If I
So
didn't have it.
Make sure you just take them out, you can put them onto the side. There you go.
Okay.
Then remember before the gloves actually, so it's a good thing I remember. We took off a bio patch, right?
Right.
And there's
Oh,
no
I had to ask for the bio
Yes,
patch.
yes,
I
yes.
keep
So-
forgetting to do that.
It'd be in a package and you open it up sterilely and you throw it on there.
Okay. So I requested the bio patches in there. They told me that like 100 times, and I just keep forgetting.
That's
it.
right. I don't know if it'll help, but basically right when you open this up, just before you even touch anything, you can add the bio patch even before the drape if you want.
Is that going to be added to our sheet?
That,
It's not on here.
yeah, I know. That I don't know, and I don't know if the kid you're gonna get is gonna have it. I don't think kids in the hospital have bio patches. I always had to add them. I'd always get them separate because they were in a sterile, like a little sterile package. And I always had to add them. So to me, I would assume that it's not gonna be in there, that you'd have to add it again. I think what it should be is right here instead of where it says open and add the chlorhexidine sponge, it should say add the bio patch.
Biopatch, yes.
Because we have the sponge in it already.
Because that's after the sterile gloves, right? So you wouldn't want to do that.
Yeah, so you,
Non-sterile gloves and then add it, but you add it first.
so yeah, so right when you take off your gloves, you wash your hands, and you get this ready. Right when you open it and it's there, that's when you would add the bio patch.
So we'll say you
So I did that.
Okay. So I have my
Okay.
gloves on. So then I'm gonna. Oh, I have to fix that.
arrange sterile
So I'm gonna get a
supplies
gas.
as needed. And then add
Yeah, you're good. You're right. So let's go ahead and bring this down a little more because that's pretend that this is gonna be sutured.
Okay.
Okay, so
So
you're,
I will cover from
yeah,
here?
Then I
you're right
take
there. Making sure not to touch anything, good. Just lay them back down on there.
clean for 30 seconds using a back and forth
That's good, that's
rub.
good, you're right there. You can just lay them right, that's perfect. And then this is dirty, so you want to throw those away.
So this is trash, but I'm just gonna finish a new one because I only had two.
Oh, yeah, that's cool. That's good. Nice.
Alright, so everything is positioned, so I'm gonna set up my equipment, my key.
Okay. And then I take the sterile swab, right? And then I
Okay,
clean
perfect. And I'm gonna start cleaning. So the first thing I'm gonna
Maybe.
do, I actually, no,
Oh yeah, so let me start this one. Don't worry about this one. Go ahead and clean right here first. That way I can explain. Go ahead.
okay. So without lifting up, I have to back and forth motion.
clean that.
And for how long?
Oh, that, I don't know.
Okay, very important. This is what you need to verbalize. You want to clean it for 30 seconds.
30 seconds.
Why is it important for the amount of time for 30
Because
seconds?
that way you ensure that everything is gonna be septic or clean.
Right, because that friction is what kills the bacteria, right? Like when we wash our hands.
So if you don't do it for 30 seconds, it won't be enough, right?
Exactly.
Okay.
I see.
Alright, so that's clean.
That's good. So then now you can throw that away, of course. And then here we're gonna do the swab. So you're gonna be able to take the swab right here. And then you can use that, but if you lift this up right here, you won't be able to clean this. I know in the video it said to clean these, but if you think about it, once this is all done, you're not putting these ports underneath that tegaderm. So you don't really have to clean those because you can clean them after you're done.
Okay.
You really want to get everything that's going to be underneath that dressing, which is right here. So you really won't even need that. You just want to clean and make sure the tubes are all clean.
When I'm cleaning, can I hold this? Because I will be I will be close to the skin.
Right, yeah, so here, you don't actually, since you already cleaned it, you don't want to touch it. So I'm just holding it down since it's sutured. So,
Oh, alright.
right, I'm just holding it down that way it doesn't move. There you go.
And I have to lift up, right?
Right, what I would do is just go under, like, do the tops first.
Okay.
There you go, there you go. And then you can get that under and just do that. Yes, back
Okay.
and forth. Exactly.
Back and forth.
And that way you have remained sterile.
Okay.
Okay, and then that's it.
Alright. And then I have to let it dry.
Right, exactly.
Well, like, it would be 30 seconds too? Or
30 seconds, exactly.
Alright, so that's, okay, so this is where I forget. Oh, BioPatch Dre.
BDD. D.
What? BD what?
BDD. Derm.
Okay. Alright, so I'm gonna place the BioPatch.
Good,
Okay, I'm gonna remove the tray.
beautiful.
And then I'm gonna start working on my dressing.
Exactly.
And I know you have a lot of problems.
It would be like around this area.
Right, so normally, so this would be a good place to put it because you're covering everything.
Right.
And see, you're already getting this to where they don't move. However, what we're gonna do is we're gonna put it up a little bit more here.
Okay.
That way these are all loose for you to put the tape, because that's in check on.
Like close to the beginning of the tubing?
Exactly, yeah, that way it doesn't, so you have that on, now it's,
So what I'm gonna do is I'm gonna start removing the paper and
Okay.
apply pressure.
beautiful, yes, that's very true.
And
Good,
then I'm gonna place, well, it comes with a label.
Right.
So I'm gonna put on the label, time, initial, and date,
okay, here, perfect. And then, since these are moving around, what do we wanna do?
the tape.
There you go.
That's crazy.
That's why we have tape.
Yeah.
Right? I'm like, why do we have this?
And you wanna make sure it's on the skin and not on the dressing.
So, we probably have class on Monday.
On the skin?
I guess he's right there.
Yeah, right on the, yeah, over there, or you can even do it a little closer to right, like right here.
So I will need a longer one.
That's good, yeah, you can do, I would do one.
So at this point, are we still sterile or like are we done?
Yeah, you technically are, but now you're good, now you've covered, this is the most important thing,
Okay,
so you can
Once
like
I
touch.
cover that, then
Yeah,
we're good.
alright.
Okay.
Okay,
Perfect.
and then,
And then, okay, I will dispose all my equipment. I have my gloves on. Once I dispose of everything, I'm gonna take off my gloves, do hand hygiene. I'm gonna position the patient, the call bell. I'm gonna make sure he's doing fine. And I think that's it.
cool, awesome. Side rails,
Oh.
all that stuff.
Yeah, sorry.
That's okay,
Okay,
Perfect.
that's it.
that's it.
Yeah.